Swipe right to connect young people to HIV testing. Midway through her sophomore year of high school, my patient told her parents that she had missed 2 periods and was worried she might be pregnant. Stunned to learn that she was sexually active, her parents took her to the pediatrician, who had another surprise: she wasn't pregnant but she did have HIV. I met her a few days later in my HIV clinic, and watched her start crying as I told her that her HIV was advanced and that she needed antiviral treatments really soon. Sadly, her story of late diagnosis is far from uncommon. 10,000 people ages 13 to 24 are given HIV diagnosis every year in the United States, and epidemiologists estimate fully half of young people with HIV do not know it. While the virus is no longer considered the death sentence it was decades ago, late diagnoses like my patient's can undermine the life-saving benefits of antiviral medications, leading to greater risk of AIDS and death. Part of the problem is the low rate of HIV testing in young people, despite the recommendation by the Centers for Disease Control and Prevention that every sexually active person over the age of 13 get tested. Earlier this year, CDC researchers reported in Pediatrics that pediatricians and parents are testing 5 times fewer young people for HIV than recommended by national guidelines. Only 22% of sexually active high school students were ever tested for HIV, and, even worse, the likelihood that young women like my patient were tested for HIV actually fell from 2011 to 2013. Shio Peer, a Stanford University student who advocates for testing and sexual health education, says his high school teachers provided basic education about HIV in a health class but they don't follow up and say, "And if you feel like you need a testing resource you could go here." There was none of that. Indeed, a 2015 survey showed that less than half of sexually active gay and bisexual adolescents even knew where they could get an HIV test. A number of groups are working on ways to improve access to HIV testing for young people. Tim Kaurdik, a health educator with the Los Angeles Unified School District, is partnering with a company called HealthVana to place educational posters about HIV in classrooms and provide students with a free iPhone app that harnesses GPS technology to locate nearby HIV testing facilities. Most public health departments and community health clinics offer free HIV testing to people of all ages, and in New York and 30 other states, children under 18 have legal access to HIV testing without parental notification. Kids who test positive can access life-saving HIV therapy early, with drug costs often covered by the federally funded Ryan White HIV/AIDS program. Kids who test negative leave the clinic better educated and probably with a pocket full of free condoms. Ramin Bastani, the chief executive of HealthVana, says their app has delivered the results of over 200,000 HIV and sexually transmitted infection tests to patients at participating healthcare providers across the country. The confidential service also gives users information on how to access treatment if a result is positive. Some young people post negative HIV testing results on social media as a way of encouraging others to get tested, Mr. Bastani said. HealthVana isn't the only app seeking to connect youth to HIV testing. The United States Department of Health and Human Services has its own locator app pointing out nearby testing services and a panoply of other resources like HIV care, substance abuse services and housing assistance. Yet another app connects users to free condoms, and there is even a mobile game designed to sensitize youth to the risks of teenage pregnancy. It's hard for teenagers to physically go places, and to know that they will be welcomed, says Karen Rain, a sexuality educator and author of the book Breaking the Hush Factor, 10 Rules for Talking with Teenagers About Sex. To Dr. Rain, the privacy of a mobile app, including the ability to delete the app after use, is a great way to draw teens out and give them the confidence to access a public physical space like an HIV testing clinic. Mobile phone apps that connect youth to HIV testing cannot supplant other proven HIV prevention methods. Kids still need quality health education in school and optional school-based HIV testing. Most important, kids need caring parents who support access to high-quality care. My patient didn't have access to any of these resources. Fearing fellow churchgoers would judge them for her diagnosis, her parents kicked her out of the house. She fought to finish high school while sleeping on a neighbor's couch and struggled to take medications and keep her medical appointments. At 18 she moved to a new state, hoping to start a new life. She and the 10,000 other young people in the United States given HIV diagnoses every year deserve more. They need evidence-based sex education, supportive parenting and better access to the HIV testing information that could save their lives.